Hello everyone and welcome back. My name is Dr. Ben Osevwe, DNP-PMHNP. Today we are talking about Viloxazine ER, also known by the brand name Qelbree. Before we get started, remember that this education is for learning purposes only. It does not replace medical advice, diagnosis, or treatment from your healthcare provider. Please do not start, stop, or change any medication without speaking with your prescriber. Alright, let's talk about Qelbree. And don't worry, we are going to keep this simple. We are not here to turn ADHD into a norepinephrine lecture with a side of pharmacology confusion. We are here to understand the medication in a way that patients, families, students, and providers can actually use. No unnecessary big words, no confusing medication gymnastics, just clear education with a little fun. What is Qelbree? Qelbree is the brand name for Viloxazine extended release. It is a non-stimulant medication used to treat ADHD. ADHD stands for Attention Deficit / Hyperactivity Disorder. In simple terms, Qelbree helps improve attention, focus, impulse control, and ADHD symptoms by affecting norepinephrine signaling in the brain. Qelbree is not a stimulant. It is not amphetamine. It is not methylphenidate. It is not a controlled substance. It is not instant focus in a capsule. Qelbree is more like a daily focus support medication that builds over time. Think of the ADHD brain like a browser with too many tabs open. One tab is homework, one tab is hunger, one tab is a random song, one tab is a memory from 3rd grade. One tab is wondering why penguins walk like they are late for a meeting, but still calm about it. Qelbree does not close every tab instantly. It helps the brain become a better tab manager over time. The goal is less chaos and more follow-through. What is Qelbree used for? Qelbree is used for ADHD. It may help with inattention, distractibility, impulsivity, and hyperactivity. It also helps with task completion, organization, follow-through, and emotional reactivity. Qelbree may be considered when a non-stimulant option is preferred, or when stimulants are not tolerated or appropriate. A simple teaching line is, Qelbree is a non-stimulant ADHD medication that may help with attention, impulse control, and follow-through over time. Mechanism of action, how Qelbree works in the brain. Let's go a little deeper, but still keep it simple. The brain uses chemical messengers called neurotransmitters. One important neurotransmitter involved in ADHD is norepinephrine. Norepinephrine helps with alertness, focus, attention, executive function, and impulse control. Qelbree is thought to work mainly as a norepinephrine reuptake inhibitor. That means it slows down how quickly norepinephrine is taken back up after it sends its message. When norepinephrine stays available longer, the brain may have better support for attention and executive function pathways. In simple terms, Qelbree helps the brain hold onto focus-related signals longer. Imagine the ADHD brain like an office where the manager is trying to run the day. The phone is ringing. The printer is jammed. Someone lost the schedule. Qelbree does not magically clean the office in one day. It helps the office manager slowly improve the system so the brain can focus, prioritize, and follow through better. Qelbree is not a light switch. It is more like installing better organization software. It takes time. This is one of the most important teaching points. Qelbree is not a stimulant. That means it usually does not work as quickly as stimulant medications. A patient may say, "I took it for 2 days and I still lost my keys." That does not mean it failed. At 2 days, Qelbree is still learning the brain's Wi-Fi password. Some patients may notice improvement within the first couple of weeks, but full benefit may take longer. A common timeline may look like: Week 1, the body adjusts. Week 2 to 4, early improvement begins. Week 4 to 8, clearer ADHD improvement may be noticed. Beyond 8 weeks, adjustments may still be needed. Qelbree is not a rescue medication. It is not taken only on school days, work days, or when you have a pile of laundry judging you from the corner. Qelbree works best when taken consistently every day as prescribed. Take Qelbree daily, not just on hard days. It works by helping the brain build steady changes over time. Starting dose, titration, and maximum daily dose. For children 6 to 11 years old, a common starting dose is 100 milligrams once daily. The maximum daily dose is commonly 400 milligrams per day. For adolescents 12 to 17 years old, a common starting dose is 200 milligrams once daily. The dose may be increased after at least 1 week. The maximum daily dose is commonly 400 milligrams per day. For adults, a common starting dose is 200 milligrams once daily. The dose may be increased weekly by 200 milligrams based on response. The maximum daily dose for adults is commonly 600 milligrams per day. Dosing must be individualized. Age matters, response matters, side effects and medication interactions matter. The treatment plan is not one dose fits everybody. Qelbree is usually taken once daily, with or without food. The capsule can be swallowed whole. For those with difficulty, it may be opened and sprinkled over applesauce. Do not crush or chew the contents. If sprinkled on applesauce, take it right away. A simple teaching line is, take Qelbree once daily. Swallow whole or sprinkle, but do not crush or chew. This is not medication granola. Do not chew it like toppings. Common side effects may include sleepiness, fatigue, insomnia, decreased appetite, and nausea. Some patients may feel sleepy, while others may feel more awake. ADHD medications sometimes like to keep us humble. The key is to monitor and communicate. Do not stop silently and disappear. Tell the provider what is happening. Important safety warnings. Qelbree carries a warning about suicidal thoughts and behaviors. This is especially important in children and adolescents. Families should monitor for new suicidal thoughts or worsening mood. If someone is in immediate danger, call emergency services. In the United States, call or text 988 for the Suicide and Crisis Lifeline. This warning does not mean Qelbree is bad. It means we monitor carefully. Monitoring is not fear. Monitoring is good care. Qelbree can increase blood pressure and heart rate. Before and during treatment, providers may monitor blood pressure and pulse. Patients should report chest pain, fainting, shortness of breath, or fast heartbeat. If the heart says, "Excuse me, I need attention," we listen. Qelbree may activate mania or hypomania in patients with bipolar disorder. Before starting, screen for bipolar symptoms. Ask about decreased need for sleep, racing thoughts, or impulsive spending. If someone says, "I slept 2 hours a night, cleaned the entire house, and decided I should become mayor," we are not just calling that motivation. We are screening for mania. Qelbree can affect medication metabolism, especially through CYP1A2. Medication interactions can change drug levels and increase side effects. Patients should tell the provider about all prescriptions, supplements, and caffeine use, because sometimes still counts. The medication list is not paperwork, it is the map. And with Qelbree, the map matters. We also monitor sleep and appetite, especially in children and adolescents. Nutrition matters too. If a child is focusing better but not eating lunch, that needs attention. We are not trying to create a well-organized child who runs on 3 crackers and vibes. Families should understand that Qelbree takes time. Families can help monitor attention, homework completion, mood changes, and side effects. Do not judge success only by whether the child is quieter. Quiet is not always better. Quiet could mean focused, sleepy, or overwhelmed. We need to know the difference. The goal is better functioning, better regulation, and safer choices, not just silence. Teaching points. Number 1. Qelbree is Viloxazine ER. It is a non-stimulant ADHD medication. Number 2. Qelbree is not a controlled substance. It is not an amphetamine or methylphenidate stimulant. Number 3. Qelbree works mainly through norepinephrine signaling. Number 4, Qelbree takes time. It may take several weeks to see full benefit. Number 5, include dosing education. Number 6, monitor suicidal thoughts and behavior. Number 7, monitor blood pressure and heart rate. Report symptoms immediately. Number 8, screen for bipolar disorder. Number 9, review medication interactions like CYP1A2. Number 10, keep education simple for patients and families. That is good patient education. Let's bring it all together. Qelbree, also known as Viloxazine ER, is a non-stimulant medication used for ADHD. It works by supporting norepinephrine signaling. It is taken once daily. Children, adolescents, and adults all have specific dosing guidelines. Qelbree is not magic. It is not instant focus. It is not a stimulant. It is not a personality eraser. It is a tool. And when used carefully and monitored appropriately, it can be very helpful. Thank you for watching. Again, my name is Dr. Osevwe, DNP-PMHNP. For support, you can text 83299 16516. Please subscribe to our YouTube channel and join our mentorship family today at rotationmatchnetwork.com.